Pinnacle Health System is a not-for-profit healthcare organization that spreads across 4 counties in central Pennsylvania. It consists of 3 hospitals, 22 primary care centers, a federally qualified health center, 2 cancer centers, 3 cardiovascular centers, and numerous labs, radiology centers, and specialty practices. According to their 2013 annual report, Pinnacle Health System utilizes a triple aim approach, a healthcare model designed by the Institutes for Healthcare Improvement, which focuses on improving the overall patient experience by improving quality and access to care while simultaneously lowering healthcare costs. In addition to the triple aim approach, Pinnacle has adopted methods from the Transforming Care at the Bedside model, which includes team rounding, rapid response teams, and interventions to improve nurse workload and clinical staff communication. Pinnacle CEO Michael Young uses both formal and informal communication strategies to reach more than 5,000 employees. With annual open forums, regular email communication, and biannual luncheon, Mr. Young is able to discuss his mission for the organization as well as communicate his strategic vision for the future of Pinnacle. This includes his comprehensive goal called Vision 2017, which includes making sure by the year 2017 that all Central PA residents are only 10 minutes from a primary care physician, 20 minutes from an outpatient facility, and 30 minutes from an emergency room. Pinnacle has partnerships with several other regional healthcare organizations, including Tristan's Radiology Specialists, Select Medical Rehabilitation, Hershey Medical Center, and J.C. Blair Health System. These partnerships, in addition to patients, employees, physicians, special interest groups like the American Heart Association and American Cancer Society, and accreditation organizations like the Joint Commission and Centers for Medicare and Medicaid, are all stakeholders in Pinnacle Health System. These stakeholders affect and are affected by the changes made around Pinnacle and are the primary factors that influence business decisions. Patients expect that they will be provided with the highest quality of care and treated with empathy and compassion. They expect their needs to be met and to have a successful health outcome with limited need for follow-up care and readmission. Employees and physicians expect to be compensated fairly for their experience and education. They expect to have all necessary training and resources needed so they may effectively treat and address patient needs, and they also expect a culture that nurtures personal and career growth and development. Special interest groups expect Pinnacle to promote patient education and improve clinical care and quality measures, and provide research and data to help support national outcome initiatives. Business partners expect Pinnacle to be an honest and trustworthy business associate, and expect the organization to maintain their reputation and good name as a leader in healthcare, since the organizations are affiliated with one another. Accreditation organizations expect Pinnacle to follow guidelines and laws that ensure the safety of patients and employees and quality of care. In addition, they expect the system to meet and excel in certain quality care indicators so that they may maintain accreditation. There is no expectation or stakeholder that outweighs another. They are all interconnected and vital to the success of the organization. The expectations of patients, employees, physicians, special interest groups, and accreditation organizations all focus on improving patient care and quality of life for society. The failure to meet one expectation can cause a ripple effect across all stakeholders. For example, if an employee misinterprets the organization's culture and patient safety is compromised, the organization will not meet the expectations of the patient. This may affect the way a patient rates their experience on the Hospital Consumer Assessment of Healthcare Providers and Systems Survey, or HCAHPS. If the organization continues to underperform in the area of patient safety, the HCAHPS scores will go down. Because Pinnacle uses HCAHPS scores as a marker for employee raises and bonuses, if this score goes low enough, employee compensation may be at risk. In addition to not meeting employee expectations, the Joint Commission and other accreditation organizations may pull the system's accreditation for not meeting patient safety measures. In response, Pinnacle may lose their reputation as a leader in quality care, which will reflect poorly on business partners who are affiliated with the organization. There are 3 types of measures that can be used by an HCO to determine whether or not they are meeting the expectations of stakeholders. These measures include structure, process, and outcome measures. 2 measures used by Pinnacle that stand out are the Hospital Consumer Assessment of Healthcare Providers and Systems Survey, an outcome measure, and Magnet Recognition Program from the American Nurses Credentialing Center, a structure measure. Using these 2 measures, Pinnacle is able to compare themselves to other regional and national healthcare organizations, and based on the result, they are able to monitor performance and make changes where needed. According to the Hospital Consumer Assessment of Healthcare Providers and Systems website, this initiative is supported by the Centers for Medicare and Medicaid and is a survey system designed to measure a patient's perception of hospital care. The survey assesses and averages patient outcomes and patient satisfaction and then ranks a hospital on a scale of 1 to 5 stars. Pinnacle currently has 4 out of 5 stars. While Pinnacle scored high in physical outcomes, the survey shows that they need improvement in the area of physician and patient relationship, as well as improving nurse and doctor response times. A study by the Health Research and Educational Trust found a correlation between a hospital's HCAHPS scores and a hospital's compassionate care practices. Hospitals that practice compassionate care enhance patients' perceptions of overall quality and an improved patient experience. This study also found a correlation between employee satisfaction and higher HCAHPS scores. This measure helps Pinnacle determine whether or not they are meeting patient and employee expectations and quality assurance goals. Another method used by Pinnacle to ensure they are meeting the expectations of stakeholders is the Magnet Recognition Program. According to the American Nurses Credentialing Center, the Accredited Magnet Program is a structure measure used to design to promote quality in a setting that supports professional practice, identify excellence in the delivery of nursing services to patients, and disseminate best practices in nursing services. Pinnacle is only one of 370 hospitals in the country to be a Magnet-recognized hospital. This measure helps to ensure that patients are being provided the best nursing care, practices are being made to retain top-quality nurses, and foster a culture focused on advancing nursing practices and enhancing collaboration efforts among all clinical staff. An article in the Journal of Nursing Management calls the Magnet recognition the gold standard of excellence in nursing practices and is a criteria when U.S. News & World Report choose the annual list of best hospitals. A study also stresses the importance of maintaining a Magnet culture after receiving initial recognition through strong and persistent leadership skills in all levels of hospital management. This structure measure ensures patients that Pinnacle controls the quality nurses they employ and push to advance nurse education, competent practices, and foster development within their nursing programs. Patients, employees, physicians, business partners, accreditation organizations, and all other stakeholders look to the leadership of Pinnacle to meet and exceed expectations. While the HCAHPS scores and Magnet Recognition Program are just two of many measures used by Pinnacle, they are measures that reflect Pinnacle's desire to exceed the expectations of stakeholders and control performance. These measures give Pinnacle an understanding of where they are not meeting expectations and where there is room for improvement. From these measures, they can evaluate, plan, and manage change where it is needed. They also use these measures to motivate employees to improve the patient experience and provide compassionate and quality care and influence the interpretation and execution of organizational culture. Thank you.